Good morning, everyone. Welcome to our MOTS client entry webinar. Today, October 7th, 2020 already. My name is Piet Vermeer, and with me are Lyle Ming, Jody Kramer, Mary Hurley, and Justin King, and we'll all be doing a small part of the presentation of the client entry webinar today. I'll be trying to keep this in a good order and fashion. And for those of you new, or just as a reminder for everybody, when you joined the webinar, a small panel popped up, and in that panel there's the option to ask any questions. If something's not clear or something's not working properly or you're struggling with something, just please let us know. That's why that is there. We are recording the webinar. We always do that, and then we post them on our website just in case you have to run off for some emergency or you think it might be helpful for one of your coworkers to review the webinar on a more convenient time for them. So that's why we record it, and usually within a couple of days it's on our website. So, okay, that's the main thing I'd like to start. And today, why do we do this? Well, of course, we want to give you any information, especially in these changing and challenging times. There are changes. Currently, there hasn't been any for the last couple of, well, quite a few months, not many changes or enhancements in the system. It's minute changes and drop downs, but that was nothing significant. So, but what we always like to do is discuss data issues. There's always data issues. There's questions and requests and demands for certain types of data that come and go. So we always like to use this platform as to discuss any of that information. And also what we really like is your feedback. If you have any comments, questions, suggestions, please let us know. And with that, of course, ideas for future webinar. If there's a specific topic or several topics that you would like to see us pay a little more attention to, because they usually start discussions within your organizations, and there's people wondering why we're doing it this way, or why shouldn't we be doing it another way, or things that they've heard in the health world. We love to share that with you guys. So. And of course, answer any of your questions. And I'm hearing a funky sound, so I'm gonna see if I can give my microphone to Lyle, and he can talk about transition. Go ahead, Lyle.
Good morning, everyone. So lately, we've gotten a lot of questions about transitioning or people leaving your organization. And we wanted to inform you that if you have a need for a transitional staff member, to let us know. So if someone's leaving, you can just email MOTS support and we'll deactivate their P number and get them off MOTS. And if you have a new user, we will send you a MOTS new user form. You fill this out for every new user of your agency. We will begin the process. This process includes a request for a P number, which also I've been receiving a lot of questions about. So I made the next slide to go over that process with you guys. So when you guys send us a request for a P number, the process can take up to 2 weeks. So we'll send you an email once we finish this process. It'll come from MOTS support, and you'll have instructions on changing your temporary password. And if you're already a user, MOTS support will send you a reminder to change your password on this. And the temporary password is only good for a few days. And we understand that this can be kind of difficult for new users you're currently onboarding and they're having a lot of new things. But unfortunately, we can't reset that new password once you get it, and you'll have to call the DHS OHA help desk. And if you have any issues with that, you can of course call me or email MOTS support, and we'll help you through that process. After you do create your new password, it'll take about 15 to 30 minutes before you need to log into MOTS to make sure that password fit on our server and that you can now access MOTS. MOTS support keeps track of the request sent to service specs for new numbers with reinstate users, and we can tell you where you are in the process at any time. And we do want to remind you all that if you are transitioning a new staff member, to not give anyone like their old P number or their old password and have them use their old login. We would like to create a new one for every MOTS user for security reasons.
Cool. Thank you, Lyle. Struggling a little bit with the systems, but there is a question. Yeah, if you have any questions, and some of my coworkers hopefully will be able to check them and answer those questions for you. And if they think it's important, maybe bring it to the floor and we can discuss those questions, or inform you of the question and the answer that we give if we have an answer, or maybe discuss the things that might be going. It sounds to me a little bit that there's some other people. Part of the presentation that maybe shouldn't be there. So if you're not slotted to speak, please try to mute your microphone. So thank you. And the next item is submit your data. And here is Jody.
Hey, Pete. Thank you very much. Good morning, everybody. I'm Jody Kramer, as Pete mentioned, and we have been receiving some questions that have been coming through MOTS support and from some vendors. I work with EDI vendors, which submit data electronically, and then, of course, the client entry users as yourself, maybe when you're changing it over to EDI. We wanted to let folks know, all of our providers, that with these inquiries, we're getting questions on whether MOTS is still required. Is MOTS reporting going away? Is there a new system? There's been a little buzz about what's happening with our, MOTS system. So we wanted to let everybody know that MOTS reporting is not going away and will continue to be required from all agencies providing the behavioral health and substance use disorder services, and this will be until further notice. So what we have been doing at our organization at the Health Systems Division here at the Health Authority is that we have a team and we have a project where we are looking at a replacement for MOTS sometime in the future, maybe somewhere between 2 to 5 years, depends on how fast things progress. But this effort is to streamline data and lower administrative burden on all of the organizations that continue, that collect MOTS data and data that's similar to MOTS. The new system, when it becomes available, will actually provide more flexibility to send additional data. This is an enterprise-wide effort, meaning that we are looking at all the different ways that you, as a provider and somebody who treats clients, submit data to us. A lot of you submit it through the web portal, through client entry to MOTS, but there's other grants or maybe services you're providing that are reported on a template. That maybe it's quarterly and it comes to a program staff, or maybe if you're a subcontractor providing services for a CCO, or you're providing services for the county mental health program, that you have to send some data to them that is outside of MOTS, but it's for specific programs or grants maybe that are, a certain window of time. The new system, we want to allow you to be able to bring that data into one system, whether it's still using client entry where you've got now another location in there where you can put your data in for that particular program or grant, as well as for EDI, if your organization moves to that, the same thought there is that your data could come in electronically instead of having to submit so many one-off forms. The reason that we want to do this, again, beyond just streamlining and lowering the administrative burden, is it's going to help give us a better 360-degree view of the clients that you're serving and their services and their outcomes. It's going to help us to better tie all of the different services that your clients are receiving throughout your organization and others here, and we can kind of see how that's going. So again, time-wise, this isn't happening this year, and it's most likely not happening next. We're going to continue to get provider and EHR system inputs. What that means is that you, every single one of you, are the people on the ground. You're the front facing to our clients, and we understand that getting your feedback, your input, and if you do have an EHR system, that we inquire with them, and you guys are part of the team in the process as we move forward. So implementation-wise, when the time comes, there will be many communications. We'll do a lot of pre-planning. There will be requirement specification, document distribution, training, testing, all of those tasks that it takes. And we're going to do this well in advance. Most of our team has been here actually from when MOTS itself came up. A lot of us are still here from 2014 and 2013. And so we will have a very holistic approach, and you all will be part of that. We've also incorporated the replies that there were some surveys that were sent out. And for those of you that took the time to fill them out, thank you very much. And we are taking those replies and putting that into our project to see how maybe timeframes might be impactful on your system that you use, or maybe your workflow that you have for entering data, so that you have an opportunity to get that factored in ahead of time as we do roll into this new expansive system. And again, we want to reach out to those of you who have, or we want to thank you for those who've reached out and asked us for clarifications. So, and we welcome any suggestions or input. Additionally, now that a lot of you that are on here do submit data through client entry, if your organization is looking at a new medical records or health records system, and and you're looking to maybe want to submit data electronically to MOTS, that is still, again, since MOTS isn't going away, that would be an important piece that you would want to inquire about if you're looking for a new system. Just to see how that functionality might work and fit within your organization. So again, just thank you all for inquiring, for asking, so we can give you some clarity. And if you have questions as we move forward, please send them to MOTS support, and we will get back to you as soon as possible. So I think that kind of sums it up for that, Pete, and I'll hand it back to you.
Thank you. Thank you, Jody. That was very informative. Okay, the next slide is going to be talk about recidivism. It's always a tricky word for me. And Mary Hurley is going to tell you all about it. Go ahead, Mary.
Okay. Right. Thank you, Pete. I hope everybody can hear me well.
Sounds great.
Recidivism. All right. One of the most common requests we receive for corrections is to change the emit date on an episode. So let me give you an example. Suppose on August 2nd, 2020, a behavioral health treatment episode for client Jane Jones, you submit it with an emission date is used August 2nd, 2020. But Janet Jones actually came in on July 28th. So you would submit a correction to MOTS to change her event date from August 2nd, 2020 to July 28th, 2020. So that is what the correction for emit date is for. But suppose you have a returning client and you're changing the emit date for a previous episode for that person to the new episode. That is not what you want to do, because it's only going to create new problems. For example, let's say that John Smith was a client in 2018. His emit date is June 27, 2018, and he finished treatment on September 15, 2018, but for some reason the episode was not closed in MOTS. Now John has returned in 2020 for further treatment, and you submit a new episode of August 1st, 2020, but you receive an error message that he already has an episode of June 27, 2018. Or if you're doing client entry, you'll notice that the episode for 2018 is not closed. And you want us to change that June 27, 2018 episode to August 1st, 2020. But that wouldn't be correct, because his record should reflect two different behavioral health treatment episodes. So what you need to do is close the June 27, 2018 episode. And then you can request that a new episode is open and use the August 1st, 2020 admission date. That's, I hope that's clear. And I will turn it back to you, Pete.
Thank you, Mary. Yes, so in summary, it's very important to make sure that a treatment episode has its start date and its end date. Even if you don't have a very hard end date, just try to close it whenever it's appropriate. And that brings me to a little reminder that last week you should have received the active client list, and that is a good tool to check to make sure that everybody on that list, according to our system information, is still active. And you should know and check within your organization, review the list, and make sure that those people are actually active. And if not, then quickly go ahead and close them, and we'll understand that things sometimes get a little bit out of hand, and but that will prevent happening issues that Mary talked about, that if a new individual comes back, that the old episode is still there, and then it looks like you have to change the admission date. No, you have to start with a new episode and a new admission date, and the old one has to be closed. So if you do not receive that report, or you're not really aware of that report, ask around within your organization, or check with us, or check your facility profile to see who the report goes to, or we can check because we know there's turnover in your organization, and maybe the report went to another person that's no longer with your organization or has completely different responsibilities. So that's why I thought I'd use this to remind you of that information or those things happening. So please let us know if you're not aware of the active client list, because it's a very handy tool to prevent situations like this and make sure that data in our system is up to date and accurate, which is also very important of all the reporting that we do. Okay, and the next slide is going to be about telehealth. Telehealth is, of course, the thing of today, with everybody working from home and everybody Zooming and Skyping and Teaming, and I don't know what other tools will be coming up. But the services, the definition of telemedicine or telehealth services is that they are healthcare services rendered to patients using electronic communications. And they could be secure email or portals, or like I mentioned, excuse me, Zoom and all kinds of online audio, video conferencing and stuff like that. For these particular services are a little different than the usual stuff. So for these fee-for-services behavioral health fee schedule, the schedule for these fees can be found on our website. We have the link at the bottom. So, and they include all telemedicine that are built with a modifier, and the modifier has to be GT. Excuse me. And the services below have been covered for several years already, but this is just as a reminder. And these services are psychotherapy, team conferences, crisis, mental health assessment, service plan development, substance use disorder services, and all kinds of behavioral health peer-delivered services. And as I mentioned, the fee schedule can be found on this link, and this link can be found on our site. And if you're struggling with that, just send us a little email, and we'll send you the link to our site, and you can get all that information about all the different telehealth codes. Okay, there we go. And the next slide is about spoofing or phishing or all that great stuff. Go ahead, Justin.
All right, thanks, Pete. So we recently received email messages from providers stating that they received a request for payment with an invoice attached, and the email appeared to be from the MOTS support email address, but it wasn't. This has happened before with this email address as well as with addresses of some other state staff. Unfortunately, our MOTS support email address has been spoofed. This is a tactic used by spammers and scammers to hide their real email address. The good news is that this does not mean that any sensitive or confidential information has been breached. Someone is using publicly available information, which is email addresses, in an attempt to get money. Phishing emails like these try to trick you into clicking a link or opening an attachment. Please do not open any of the attachments. They may contain malicious code. Also, please do not reply to it, because that just confirms to the scammer that you have an active and valid email address. Best thing that you can do is just delete the message. If you're unsure whether it really came from us, you can forward it to the real MOTS support address, and then we can confirm or deny it as a valid message. Then just a few tips to verify that the email from OHA is authentic. Number one, check the display name against the email address. Depending on how you access your email, you can do this by hovering your mouse pointer over the email address, or by right-clicking it to view the details of the properties, or by copying it, pasting it into another program like Notepad. Number two, MOTS team and Health Services Division staff will not request payment for invoices or send invoices directly to providers. MOTS support doesn't even have anything to bill you for anyway. And even if we wanted to do that, we have no way of processing payments. So if you get an email that says it's from MOTS support asking for money, you can be pretty sure it's fake. Number three, check for obvious grammar mistakes and misspellings. Also, watch out for the word kindly. In my personal life, I follow an anti-scammer community on Reddit, and that group has observed that a surprising number of phishing emails include kindly as part of the scammer's instructions, such as kindly fill out the attached form. And number four, check the salutation for an actual name instead of a generic greeting. MOTS support will use your name in a greeting whenever we can, or the agency facility name, or something like MOTS System Administrator for more generic email messages. But again, receive a message that makes you suspicious, you're welcome to forward it to us for a second opinion. Just let us know you think it's something untrustworthy so that we know what to do with it.
Thank you, Justin. In other words, don't be kind, right?
Something like that.
Okay. I thought this is a good time to check if there's questions, and I don't think I see anything at the moment. Did anybody receive any questions that I might have missed, or because I think we're running through it pretty smoothly. Go ahead.
Yeah, we received one that just that asked about for mental health clients, which ones are required to be sent to MOTS. So I did a answer to that and included all so everybody could see it. And just if any of you have questions on who should or should not be reported from your organization, please reach out to us, and we can assist. Each organization is kind of unique, so we can make sure that you're getting all the clients reported to us that you should be.
Excellent.
And I can read my answer if you want me to, but it's up to you.
Sure.
You want me to read it? Okay. Okay. So my answer was, so for MOTS, all clients are required to be sent to MOTS who are covered by the Oregon Health Plan, Medicaid, and through a CCO. So if you're providing services for those organizations and those type of clients, they need to come into MOTS. MOTS also requires clients who receive services that are also covered by any form of public dollars, such as grants, or if your organization is contracted with the county to provide services on their behalf, or any other public dollars. MOTS also does require all methadone and DUII clients to be sent to us regardless of who pays for these services, even if it is private insurance or self-pay. I indicated that we would be happy to, get my mouse to go here, we would be happy to set up a time to go over the specifics of any organization to make sure that all of your required MOTS clients are being reported to us. So it was a question specific for mental health clients, but I kind of included all the caveats that we typically pass on to folks for required clients.
Yes, and I think I saw something pop up about assistance funds.
Oh,
I assume I'm not 100% sure what assistance funds are and where they come from, but if they are public funds, then any public funds, uh, individuals, and usually what our experience is that individuals who are treated, the financial situation is usually several different funding streams are used. There's some sliding fee scale, and there's a 10% from this and a 30% from that, and kind of put all together. And from our experience, that basically everybody who's licensed and certified by the Oregon Health Authority, all clients should have their episodes in the system. And one thing that we sometimes talk about, and it's usually a little tricky, is that the difference between treatment episodes and the non-Medicaid services. And for the non-Medicaid services, you have to go to our documentation because that's a little different. And there's a lot more exceptions to that story. So, but the basic regular treatment, if you're licensed and certified by us, if you work for the county or if you work directly for us, uh, any public grant or anything, those clients need to be submitted into MOTS and reported to the Oregon Health Authority. So that's
and
usually
Pete,
my take.
on,
Go ahead.
this is from Valerie. What we can do, Valerie, is I will look up your email address, and we do have a document that talks about which clients should be reported for status. Well, it's called status, but it's basically who the client you'd enter through into the MOTS client entry portal. And then it also talks about what services are considered non-Medicaid. And I believe that this crime victims assistance funds are possibly identified in that document, because we went through this with a couple different providers to really get down to the granular level of some of these things that they have. So I will go ahead and send that out to Valerie. And then, Valerie, if you have any questions, you can get back with us and we can help you from there.
Cool. Thank you, Jody.
Mm-hmm.
Anything else popped up from anybody?
I don't think so.
Okay. Let's go to Jody's specialty, switching from CE to EDI.
All right. Thank you, Pete. So as I mentioned earlier when I was speaking, I work with a lot of the EDI providers who submit data electronically to MOTS instead of through the web portal. So we have this slide for those of you who may be deciding, like, hey, we kind of want to look at a system that can do EDI submissions to MOTS, or you may even be working with your existing system and they may be developing something for you to send to MOTS electronically. So these are just some steps that we've come up with that are really important if you are thinking of making a change from your current CE to EDI. Number one is notify us of the change. Even if you're thinking about it, you're not sure, if you could just give us a heads up, it really allows us and our team to make sure that we have you on our radar, that we're able to get you into the queue and make sure we have resources associated with your project to see it to success. Secondly, if you are looking at electronic health records systems, one of the things a lot of you, and we've had you inquire with us, is the MOTS functionality for submitting through EDI. If you're looking at different systems, all systems have different ways they submit data to MOTS electronically. What we found is helpful is when you're getting your presentations or your demos or your responses from the different systems that you're looking at, ask for that demo of exactly how the MOTS functionality works. There's no one right way or wrong way, in our opinion, as long as it meets our formatting standards. But there are a lot of different workflow processes from system to system. So it's just good for you to kind of see that, if possible, so that you can determine really how much of a business flow, how much staff time, because there still is that human involvement and attention to submitting to EDI. So just want to make sure you're aware of that. We found a lot of folks have been like, hey, thank you for that. That was super helpful for us to kind of get those MOTS specific demos of what we were looking at. Third thing is project timing. We're going to do our best to make sure we have resources on our side available for you, your team, and your vendor. We will go through a process of switching from the client entry to the EDI. We will set up an area called a secure file transfer protocol. And essentially what that is in simple terms is a location on our servers here at the state where either your system or your staff will drop off your EDI files into a mailbox that MOTS picks them up, processes them, and sends you back some mail the next morning telling you how your file did. Then we'll talk about client ID considerations if you're going to be changing your client IDs, because sometimes when you go to a new system, there's a new assigned generated one. We talk about that and how we can accomplish that if we need to make those changes. Our teams assist with that most of the time. Define your business processes. This is just kind of a step for you, but we're happy to have involvement to, if you have questions or things that have worked or don't and want our involvement, we can definitely make that available to help. You're going to test your files through EDI. So if you're looking at a new system and they're like, oh yeah, we submit to MOTS and we have, X amount of people who are already submitting to MOTS or providers, what you need to remember is that the testing and certification of the files from that system will still have to be done, even though others submit with their system, because with all the unique setups and ways that you can customize your particular setup within their program, we want to make sure that yours meets all the specifications and requirements. So we're going to test yours at your level. So just so you know that we certify at the provider level. We're going to go live, and then after we go live, we're going to do some follow-up. And the follow-up usually is found to be important. It could be weekly, it could be monthly, it could be whatever interval your organization finds appropriate, but it helps us to answer any questions you may have as you're submitting data now through EDI, any questions on the file you get back in the morning from MOTS saying how your submission went. So follow-ups have been really good. And so those are kind of the key points that we found to be most important. And by all means, biggest thing, notify us of the change. You can always send it to MOTS support. They'll get it to myself. And if I'm unavailable, Pete backs me up. So we've got you covered. And then we can help you from there. So communication is key to making things a success. So with that, Pete, I'll hand it back to you.
Excellent. Thank you, Jody.
You're welcome.
And one of the questions that I saw that popped up were about the active client list and if a person can be added to that list. Unfortunately, and that's one of the things that we would like to change in our new system, is we do not have that flexibility. We have one primary facility contact in the system, in the profile of the facility, the way it's set up, and that person will receive that email is where we are sending the active client list to. If you want to set it up within your organization to kind of let it automatically go through that, you can probably do that. But if it's going to the wrong person, please let us know, because we can change that. We can make that change. Or if you have your own agency administrator, that person can actually make that change in the system. They should have the rights to that up. So I just wanted to mention that. Okay, any other questions that I might not have seen here or there or that popped up?
There is one about the password, when they log into MOTS and it says my password's going to expire in like negative 18,000 and some odd days.
Oh,
they
that
want to
one,
know
yeah.
if there's going to be, at what point there may be an accurate update, because it sounds like to me that even though that they're getting that, they're concerned that it's not accurate, so they don't get a notification that they don't get locked out.
Well, that's one of the changes that have been made, is that our current passwords are not expiring. And that was due to the whole COVID situation, is because everybody was working from home and there were a lot of changes. So for the time being, they said, well, and the way they made the change is that it shows as a negative number. If you see a negative number, and I just realized that a little while ago, that my regular password for MOTS and stuff like that for production has not changed for a while. And normally it should have been, but it's been the same as it has been since March, April or something, I think, when the last time I changed it. So there has been a change, and if you have a good password, great, keep it, because I don't think it is currently asking you to change unless it's different for P numbers as it is for OR numbers. I'm not aware of that. Anybody know that? Because we all have OR numbers, but maybe Lyle or Mary know that it's still changing for the P numbers or something. But
I
I
don't
think
know.
if the P numbers also see that negative number, I'm pretty sure that it means that their password is not going to expire for the time being until something has been set up and organized to change that. Go ahead, Mary. Sorry.
You can, if you want to change your password, you can always go into Citrix and change it. Just be aware that you're going to have to wait before you go back in to MOTS with that new password. So, there's
True, but
nothing that says that you can't change it.
yeah. So
I think
unfortunately, the way the programming has been set up, we cannot fix that, and it's going to show as a negative number. So sorry, Jody, you wanted to chime in?
I was just
Cut you off.
Well, I was just going to say that it might be that the password may not be expiring, which we definitely probably need to get an answer to this and send it out to everybody for sure on the P numbers. But I'm thinking that it might be too, like, the MOTS is still going to lock you out and disable your account, even if your password hasn't expired, if you haven't logged in for a while. And I don't know what that threshold is, Mary. Is that 60 days?
It's really hard to. I don't know what the threshold is. So.
We'll try to get information on that and maybe talk a little bit more about it in our next webinar, because that's probably the same for everybody. So, and if you have information for us, please let us know. Send it to the mots.support@dhsoha.state.or.us. Any email, any questions at any time. So,
We do have a question on that particular topic, Pete, that somebody asked. What is the usual timeline to receive a response from MOTS support?
usually, my experience is within a day or two or so, depending on how busy and if nobody is out sick, or because there's several people covering the MOTS support. So we have 2, 3, and if they don't know it right away, then unless it's accidentally passed on to somebody who goes on vacation and didn't get to it or something, or has fallen ill. But from my experience, within a couple of days, there usually should be an answer. And if you did not get the answer, there's always you might have our email numbers. You can try an individual number, email address, because maybe something happened with the number, or the person forwarded it and it didn't get into the right place, so they're not really sure how to answer it or who to find it. So it might take a few more days. But my experience is that, and from what I've heard from most of our providers, is that it's pretty quick within within several days. So. We don't have a standard set for that, so. Okay, I think that was the questions. Okay, and like I said, any email, any questions, anytime, mots.support@dhsoha.state.or.us. Recording of this webinar is going to be posted on the MOTS website, and you can see the MOTS website at the bottom, and it usually takes a couple of days. They're pretty quick at our web support team. So the MOTS Messenger is also a great source for information and for changes or updates on anything happening in the MOTS world, and you can also find that on our website. It's also sent out on a monthly basis for individuals to read. The next EDI webinar, well, it's similar as this one, but the focus is more geared towards the electronic data interchange or EHR, EMR treatment providers who have the EDI set up. And unfortunately, the classroom trainings that we used to do on a monthly basis at Cherry Avenue in Salem are still canceled until further notice. There has not been any changes. So there's still a few on the list. I keep them on there, but as they get closer and we get to the end of a particular month, and I haven't heard anything about opening up, then I'll take it off. So, but I'm always hopeful that maybe something happens or some great breakthrough is coming our way, and then within several weeks we might be able to do a classroom again or something, or under specific certain circumstances we might be able to do a classroom if it's available. But so far they have all been canceled until further notice. Okay,
And Pete,
thank you for joining us. Yes.
Sorry to interject. I was just gonna maybe mention that if they do need trainings, that you know, that we have the videos, but that also they can request a virtual training with either like Lyle or yourself for staff. You know, use them. That's kind of how we've been bridging the gap.
Definitely, of course. Sorry, how could I forget that? Yes, because I have one tomorrow. I think I'm doing for a certain provider. So, and Lyle's available, and we have great videos that Justin made, and you can find those about all the subjects also on our website. So, thank you for joining us today. Thank you, Jody, Mary, Lyle, and Justin for helping me out. And as I said, have a wonderful rest of your day. Thank you.
You too. Thanks, Pete. Thanks, everybody.
Take care.